All right, FTI Tribe. And this has been a little while in between webinars, but I'm really happy to present this latest webinar to you, which brings us a great professional who's a researcher and who happens to be one of a protege to Luke. So he is learning from Luke himself, Luke Del Vecchio, who a lot of you may know. Has been in the FTI education ranks for a number of years, making sure that our education is evidence-based and continues to be at the forefront. So in a moment, I'll get Ian to present himself a little bit more and just share a little bit more about you, mate. So Ian Miller from Southern Cross University is going to talk about functional benefits to alternative training methodologies in older adults and children. It's a bit of a heavy loaded heading there, Ian, but we're looking forward to you presenting and breaking down those parameters for older adults as well as children too. So there's a lot to get through. We're aware on this webinar. So for those of you who are going to be listening in, no doubt there's been requests for strength training for older adults. And also, curiously enough, for children as well, and how to approach the training parameters around those two kind of specializations, if you like, rather than general population. So, Ian Miller, welcome to the High Performance podcast. So, did you want to just talk a little bit about yourself, and then we'll get into the presentation?
Yeah, no worries, and thank you for having me. As Tarek presented to me, I'm Ian Miller. My background is in exercise physiology and chemistry. So I've worked alongside Dr. Luke Del Vecchio and Associate Professor Mike Klimstein at Southern Cross University, and I'm continuing my studies, and I'm a PhD candidate for the next couple of years. My project is looking at any skin cancers and which are non-melanoma and melanoma related, like in people that are in aquatic sports and outdoor enthusiasts. So that includes walkers, runners, cyclists. We're doing a bit of the groundwork in checking what the prevalence types and treatments may be. Then we're also looking at some of the artificial intelligence that's involved with some of these digital dermatoscopes. So that's my next couple of years. On the side, I also work as an exercise physiologist, and I work predominantly with an older population, but we work with people across the board. Generally, we tend to find people either have got heart conditions, they've got musculoskeletal conditions, they've got metabolic disorders, whether it be type 2 diabetes, or they may have like COPD and exacerbations from different lifestyle and nurture factors.
Mute you there. That's quite a full-on endeavour there, and no doubt that's keeping your hands pretty full. So really appreciate you making the time to deliver some of your knowledge bombs and experience as well, particularly having worked already with older adults. So to that end, what I'm going to do is, Ian, let you present your material, and at the very end, perhaps you can invite those who are going to be watching and listening into this pre-recorded webinar about some possibilities, maybe how they can find you and what have you. So without further ado, I'm going to leave you in the great hands of Ian Miller over the next 40 to 45 minutes. So Ian, all the best with it, and I'll be here. So I just won't be visibly here. So over to you, Ian.
Thanks very much, Tarek. I'll just share this screen. And
you can see this.
Can you see that okay, Tarek?
Yeah, sure can.
Yeah, perfect. Well, thank you, everyone. So what we're looking at is the functional benefits to alternative training methodologies in older adults and children. So I'll go to the next slide. The first part of this presentation will be focusing on older adults. So we're looking at the age-related declines in physical function and why exercise is important for this, this group of people. We're then looking at supplement and exercise interventions to combat sarcopenia. And we'll explain a little bit of what sarcopenia actually is. Brain health and exercise interventions that target cognitive decline follows, and then the need for motor skill training with age. And that's where we'll touch on some of the research that I was privy to, working alongside like great researchers at Southern Cross University, like Dr. Luke Delvecchio and Associate Professor Mike Klingstein. The second half of this presentation, we're looking more at children. So in focus, more children between 5 and 12 and 13 and 17, like not so much focusing on children below that age. We'll focus on why do children actually need exercise, the movement competency and links to obesity and sedentary behaviour. We then look at different batteries of testing for children, and then some of the physical competency benchmarks that are out there. In particular, we'll be looking at normative values for Australian children, but if anyone is interested in what different competency benchmarks there are for different demographics, whether it be in like America, in Europe, like in some of the South American countries, like we're more than happy to look at that in the future if that's what you're interested in.
Yeah, sorry, Ian, I'll just hold you. That's a great point, because I think at the end, it's interesting to see how the different environments play out. So, and the impact on culture and adoption of let's say physical activity. So I'd love to see that sort of environmental aspect with regards to the interplay between children being reared up, for example, in an environment that may or may not foster physical activity. So that's fascinating.
Absolutely, yeah. Okay, are you happy for me to go on with
yeah.
Yeah, no, you're fine. Okay, so, well, first of all, we'll touch on sarcopenia and what it actually is. So sarcopenia is a progressive degeneration of skeletal muscle, mass and function brought on in older adults. Essentially, if you've heard of atrophy, we're in the same ballpark, but it's mostly focused on the effects of muscle loss in older adults. It's also associated with falls, functional decline, frailty, and mortality. What we'll look at is a little bit of the physiology and chemistry behind it, which is mostly you're looking at reduced motor recruitment, not as many fibers, and the mass of your muscle fibers reducing. Next point is, can it be stopped and can it be delayed? The short answer is sarcopenia can't be stopped. Like as we age, our muscles do tend to waste, and we're not as apt as we were when we're in our younger ages. Having said that, it can be delayed with modified lifestyle factors. This includes physical activity or exercise. Diet can play a part in this, and also adequate sleep and making sure that there's not too many external factors like smoking. So I'm sure many people have seen this picture floating around of the internet, but this came from a research paper by, and I can't say that name, but it looked at chronic exercise preserving lean muscle mass in masters athletes. So what we're looking at here, that top picture is a 40-year-old triathlete. And what you might see, this is from a cross-section or an MRI of somebody's thigh. And the middle section here is bone. And this big section here in the middle, that's the muscle fibers. This small section here is the adipose tissue and your skin. This bottom picture, or the middle picture, you'll see someone who is like an older adult, and they've lived a sedentary lifestyle. And you can see it's quite clear that there's a difference there. This middle section here is the bone. This smaller section here in the middle is your muscle fibers. And this much larger section here is the adipose tissue or the fat layer. Oh, this bottom picture here is basically alluding to that and it's not required for someone just automatically to age and lose all of their muscle mass. If there's a lot of exercise, especially resistance training, aerobic capacity, like training, then you can maintain a lot of that muscle mass within reason. This next picture here, like I don't want to go too deep into some of the biochemistry, but it just kind of explains like some of the pathways of sarcopenia and how it becomes. So when you're getting mitochondrial dysfunction, and that's usually your energy reserves in your skeletal muscle, you've got reactive oxygen species, which tend to degenerate the layers in your inside your body. You've also got hormonal changes, so it's a reduction in growth hormone, testosterone, estrogens, and an increase in myostatin. You then have a decline in neural function, which is your motor units. It's very similar to the skeletal muscles shrinking and reducing how many fibers there actually are. You also have malnutrition. That's where we're looking at the diet that you're actually bringing into your body. If you don't have the diet coming into your body, like you can't possibly make the skeletal muscle that you require. This next section here is reduced satellite function, cell function. This is focused on musculoskeletal fibers. It's kind of stem cells like for muscles to help regenerate new muscle fibers, which is something that continues all the way through life. As we tend to age, that tends to reduce. We then have chronic inflammation. This is much higher in people that live a sedentary lifestyle, like and have a higher fat content coming into their bodies. And then you've got your lifestyle factors here, which is mostly reduced physical activity and increased obesity and increased smoking. All of this is linked with a reduction in muscle health, which is leading to sarcopenia. We also have cognitive decline. When you think cognitive decline, think the ability to think, learn, and remember things. It's associated decline with the aging process. With the physiology and chemistry, if we go back to that previous slide, this is a reduction in motor units and a reduction of the fibers that are required. That's in a nutshell with the chemistry. Can it be stopped and can it be delayed? Again, just like with sarcopenia, like the short answer is no, it cannot be stopped. Having said that, it can be delayed. Like and physical activity and exercise is one of the key points for that. If we go back to this slide here, like I don't want to focus too much on this. This kind of goes into some of the different like pathways in your brain. Oh, sorry. Some of the different biochemical pathways like in the body, like associated with sarcopenia and cognitive decline. What you see on the side here, like is, I don't want you to focus too much on the L section here, but with your lactate, like you do need a certain amount of lactate in your body. It's associated with memory, learning, neuroprotection. A lot of these myokines, as you can see on the side here, they all have a relatively positive effect on the brain, but you must understand that within reason, you don't want to have too much of anything. Your body really wants to maintain a nice level of homeostasis, like where it goes up a little bit and down a little bit. You'll have higher levels of, like, heart rate's a good example. Like your heart rate will be at a baseline, like, and you'll have, sometimes it'll be higher, sometimes it'll be lower, but generally it wants to stay like along that fine line, and your body kind of operates this way. So there's a paper by in 2008, like looking at motor skill learning in older adults. Without going too deep into this paper, the key points we found were the fine motor skills, they do diminish in older adults. Gross motor skills, however, there's contradictory information between different studies that this paper focused on. What they tended to find is they would lose some gross motor skills, but it's not necessary that is the case. What in a nutshell basically means like gross motor skills loss, it's not absolute. Just because you're getting older doesn't mean you have to lose your gross motor skills. And then I want to take you through, so that's some of the background towards why exercise is important in older adults, but we need to focus on screening and why it's important. So a battery of tests or a screening process is really important, getting a baseline for initial testing. If you do have any of your clients that you're working with, you really need to know where they're starting from. Retesting, whether it's weeks or months down the line, allows for either progression or regression in your clients, and see how the exercise is actually treating your patients, for lack of a better word. If you're giving them exercise and they're actually regressing, well, we need to come at it from a different angle. Having said that, if we're giving them exercises and they are progressing, maybe we need to, that's a good thing, obviously. We need to make sure that we continue changing up the program so they don't plateau out and start to decline. There's two different batteries of screening, or two main ones, in older adults. One of them is the functional movement screen, by Cook and colleagues, which was developed in 2010. But the one that we'll focus on is the senior fitness test battery. So this is a couple of the actual tests that we utilize, with older adults. A big favorite on many of the exercise physiologists is a sit to stand. It's where you've got a client and they're in a chair and they're standing up without using their hands. So not everyone can do that, but if we're trying to strengthen their core, we're trying to strengthen their legs, and we can progress them from using their hands to no longer using their hands. Not only do we improve their health, we're also allowing them to have their independence, which is so important. This next test here is a 2-minute step test. It's where you get a client and they're in one position and they're stepping on the spot for 2 minutes. With this one, we're testing their aerobic fitness, or their cardiovascular, endurance. This next one here, is a seated arm curl test. Generally with females, they're given a 2 kilo weight, and with males, they're giving a 4 kilo weight, and they're doing as many arm curls as they can, or bicep curls, as they can within 30 seconds. You then are testing flexibility, so we check lower limb flexibility. We can do a seated sit and reach, which is this gentleman on the left, reaching his foot. Basically, if he can reach his foot or go past it, we record that number. If he can't reach his foot, we record that number and we compare it against the normative data to see what his flexibility is. Same thing with the back scratch, which is the second test here. This one's checking your shoulder mobility. Essentially, you've got one arm going over your shoulder and the other arm going the other way. You're trying to see if your fingers can overlap. And the final test here is a timed up and go. This is testing dynamic stability for your patients. So this next slide here is just going into the actual normative data, from these tests that we've just gone through, and your different age groups. So I won't delve too much into this, but we'll just go with the first column. What you see here is your age. It's 60 to 64 years. We'll go to the arm curl test, and you're looking at 13 to 19 repetitions. And that would be within 30 seconds. As the different age brackets go up. You got 65 to 69, 70 to 74, and so on. You can see that those numbers tend to go down, which is expected with a decline in age. But what you will find, if your clients can't do below 30, or they do below 13 repetitions, they're below the standard. If they do above 19, they would be above the standard, which is an indication of good upper arm strength. And what we see here is the same, but with the men. Generally with the men, you'll see that they've got higher results when it comes to their upper limb strength and their lower limb strength. But when it comes to the flexibility, they tend to be on the opposite, women tend to be better. This next slide here, what we're looking at is some of the alternative research that is coming out in regards to traditional exercise for older adults. There's been a lot of research looking at yoga. There's been a lot of research looking at traditional resistance training and aerobic training. But there's newfound evidence coming out that you can use non-traditional exercise modalities, and they have a place for older adults and for younger children as well. So this is a paper that I worked alongside with Luke Del Vecchio, and we did a systematic review of all the hard martial arts. So they're more your striking and kicking and punching type modalities. And what we found is there are improvements, but because there's only 6 papers out at the moment that met our criteria, it's hard for us to say that, yes, older adults need to do this. Having said that, it does give older adults an alternative training modality instead of the traditional gym-based modalities. Not all older adults do want to go into a gym, so it's good to see alternative options, because if we can avoid sarcopenia and cognitive decline, then we're improving their quality of life. The last thing here I want to leave you with is the physical activity guidelines from ESSA. This is a new position statement that came out in 2021. Without going too deep into the paper, the key points I really want to leave you with are, it used to be 150 minutes recommended exercise, but now the guidelines have increased to 300 minutes of at least moderate intensity aerobic activity. The old recommendations were 150 of light to moderate intensity. So if your clients are looking at losing weight, or gaining muscle, they really want to be upping the amount of exercise that's required. It's not just exercise, it's also a combination of diet and physical activity to produce the greatest sustained weight loss. And finally, recommendation daily energy deficit, that's not as much input as there is output. You're looking at around 500 to 600 kilocalories to maintain reduction in adiposity. All right, so that was older adults. We'll move on to children. And why do children need exercise? So first of all, there's metabolic, which is type 2 diabetes, cardiovascular. Some of the examples of that are without any exercise, you tend to have an increase in blood pressure and an increase of cholesterol. There's also, children have joint problems and musculoskeletal complications that start when they're younger and will continue all the way through their life. Exercise has a definite impact on their self-efficacy and their anxiety and depression. So really important for children's mental health. We've got hepatic and renal, so you're looking at the liver, you're looking at your urinary systems, also your gallbladder and your pancreas. And also there's improvements with management of asthma and also sleep. This slide here, these are some of the reasons why childhood obesity and sedentary behavior is linked. If you look here, there's 4 different circles. Like, without going too deep into all the smaller little numbers, I really want you to look at hypertension. So exercise has an impact in dilating your blood vessels, which will bring your blood pressure down. We know that as blood pressure increases, every 10 mils of mercury that it goes up, your increase of myocardial infarction and stroke, like they go up. You also have inflammation. This first one here is C-reactive protein. That's generally a protein that is elevated like in the early stages, like when you're sick. And like oxidative stress, again, that's the reactive oxygen species we were talking about a little bit earlier. This is linked with endothelial dysfunction. This is the layers inside like your blood vessels, like inside your urinary tract, inside inside like any of the lumens that are inside your body, like any of that endothelial dysfunction or the inner layerings, like they don't operate as well as they did, which can have an impact in the protective lining like of your blood vessels, namely like higher levels of lower density lipoproteins or lower density cholesterol can actually get into your blood vessel walls and start building up like these little plaques. And that's where we're looking at atherosclerosis. So it starts when you're younger, and it's a silent disease that when all of a sudden you start getting these chest pains and you start getting like complications in later life, if we continue exercising when we're younger, we're able to delay a lot of the process from happening. And this bottom section here is dysglycemia. This is the onset of diabetes. Like on the side here, we're looking at your BMI or your body mass index, like for boys 2 to 20 years. And what if you're looking down this bottom here is your age. So it's like 2 to 20 years. It's maybe, I'm not sure if it's easy to see or not, like, but if you go to, we'll go to 12 here. And if you go up to there, like what we're looking at is on the lower end of normal for your BMI. This green section here, like is your normative value. As we're going into yellow section here, like as the BMI is increasing, that's where you're getting people that are overweight. And this red section up the top here is when you're going into the obese category. Generally, when you're looking at your BMI, 20 to 25 is your normal range that you're after. If it's below 20, it's on the lower end. When you start going beyond 25 to 30, that's overweight, and you're starting to get those earlier onset of complications with your health. When it's above 30, that's when you're in the obese category. The higher that number goes up, the earlier onset complications happen with your health. This slide here explains a little bit of the consensus of children, like and their normal weight. So looking here, there's about 3 million children. This slide here correlates with this pie graph here. So about 2/3 of children were in the normal weight category, and these are numbers based in Australia. This number here is the other portion. This is for children if they were either overweight or obese. Again, that's in this section here. There's also underweight, but you can see that's about 90% like of children there. This bottom slide that we've got here is showing that it's about 23% of the children were either overweight or obese. Like it did spike between the years of 2011 to 2015. And then with updated data like to 2018, it's gone down from those numbers, but it has increased from 2007. So it's fairly steady, if not a slight increase. So when is it okay for children to start training? The general consensus for physiological adaptations is 6 years of age. Having said that, it's going to vary from child to child. The general consensus is if the child is ready for organized and structured sports, they're ready for a supervised resistance training program. Neurological, like adaptations, the earlier you can get younger children training, the better. Their brains are plastic, if you will. So if you start earlier, like you start building the good connections, like so this is connections from your brain through to your muscles, so very important. And psychological links with self-esteem and self-efficacy. There's a couple of different battery tests for children. You've got Eurofit, and this battery of testing is kind of focused in Europe and the Asian countries. FitnessGram is used much more in North America, and the functional movement screen is another one that's used in, it's around the world, but it's used in America as well. Some of these other ones, like INDARS, Czech Republic focused, and all the bottom ones that we've got here, like OVO and UniFitness, they're starting to be replaced by Eurofit, FitnessGram, and the functional movement screen. So these are the type of testing that you have with the Eurofit. Like we've got a balance test. This plate tapping is your dexterity, like in your hands. So this bottom picture here, the child has their hand on this blue paper here. Their other hand starts on the yellow circle, and then it goes over to the other circle. That is 1 cycle, that's 2 cycles, that's 3 cycles. And they're counting as many of those as they can in 30 seconds, checking their coordination. You then have sit and reach, which is your flexibility, standing board jump, like checking your lower leg power, hand grip strength for strengthening your upper arm, sit-ups, so that's your overall functional ability, like with your upper body, and bent arm hang. That's kind of like a chin-up. A child starts from the ground, they go up into a chin-up position, and they hold their position for as long as they can. As soon as their chin goes underneath the chin-up bar, that's when the test is cut up. And the bottom ones there are your 10 by 5 meters shuttle runs, checking your speed and your agility. And the bottom one there is your 20 meter, like a beep test, like it's your shuttle run. As you can see with the FitnessGram, it's very similar to Eurofit. Like it has a pacer test, 1 mile run, and a walk test. The pacer test is the equivalent of your beep test. Body composition is utilized by body mass index, or your BMI, which can be calculated by your weight divided by your height squared. Your body fat percentage is either used by bioelectrical impedance or by skin folds. We tend to head more towards your bioelectrical impedance. Having said that, not every school has access to one of your bioelectrical impedance scales. So if that is not an opportunity, like skin fold is a less suitable alternative. You then have your muscular strength, which is very similar to Eurofit. We're looking at your push-ups, like your sit and reach, your shoulder stretch. The trunk lift is the picture down the bottom here. And the child starts lying flat on the ground, and then they try to raise their body off the ground without lifting their hips off the ground. And it's a measurement of their back strength. Finally, we have the functional movement screen. This is used in all different age groups, like it can be used in younger children, older adults, and adults as well. The there's 7 main movements, and you're looking at your deep squat, hurdle step, inline lunge, shoulder mobility, active straight leg raise, your trunk stability or your push-ups, and your rotary stability. A lot of this is targeting more towards functional movements, which is important in older adults and younger children, especially older adults, because if they can do a lot of these tests, it helps them in their activities of daily living. It can be as simple as turning off a light. As for children, what are the actual physical activity recommendations for children? For children under the age of 5, like the guidelines essentially is like reduce the screen time that they have access to. And with the 180 minutes of physical activity per day, it's mostly just movement and like socializing. It's not necessarily recommending getting them into a gym or doing any organized sport. As for children like from 5 and up, like 5 to 17 is what we're looking at here. They're looking at 60 minutes a day, moderate to vigorous, intense physical activity, which is more in line with older adults as we went through before. No more than 2 hours a day of screen-based activity for entertainment, which is interesting when you think of it, like because our whole world is electronic based now, like people looking at their phones. So like if we can reduce how much screen time they're doing and how active they are, like it's going to help their health. Finally, what we're looking at here is some of the actual benchmarks like for Australian children. And I don't want to go too deep into this, but I'm more than happy to share this if people want to look at the different normative values. Just to explain, we're looking at 1.6 kilometers shuttle run, or sorry. We're looking at your aerobic fitness. And this top bit here is the percentage. So right in the middle there is your 50 percentile standards for boys is the top, like so that's 9-year-old boys. It's 522 seconds. So that works out being about 9.5 minutes. And then the girl equivalent is down the bottom there, like at 609 seconds, works out being about 10 minutes. As you can see on the upper end, like the times get quicker, but there's a smaller proportion of children in those brackets. And this paper, look, it assessed the data of about 85,000 children between the periods of 1985 and 1997. One hard part when it comes to benchmarks is you do have your Eurofit, your Fitnessgram, and your functional movement screen. It's hard finding the same benchmarks for all activities. So when there is like a larger screen, like that's why it's not updated every year, because a lot of data and there's a lot of different fitness battery tests like compared. This one here is your 20-meter shuttle run, and this is more in line with your beep tests. This one here is more looking at sprinting ability, like so you've got boys at the top and girls down the bottom. And down here, like you're looking at like more your upper body strength or your functional strength. So again, this is your P50. This is like your 50 percentile. You're looking at the amount of push-ups that the children can do. So you got boys at the top here and girls down the bottom. Finally, what I'll leave here is my recommendation when it comes to any like exercise. When you have any of your clientele, you really want to do like an initial assessment. So that would be screening and making sure that they're safe to actually like complete exercise, but also doing your initial testing and seeing where they are from both a physical and a mental point of view. You then can plan what you actually plan to do with your clients, like to help them improve in the areas that they want to do. Next is the delivery. So that's the actual doing the actual physical activity. You then have monitoring. So you're making sure that they're feeling okay as they're actually doing the exercise. If it's too hard, we need to maybe think about conditioning them like on a more gradual scale. If it's too easy, maybe the intensity can go up a little bit and they'll get greater improvements. And finally, to see if there are actually their improvements, we want to go to the review process where if we did the initial battery of tests at the start, if we do them at the end, we can actually monitor to see if they've had those improvements or if they're actually starting to regress in their capacity. That's the end of the slides that I have there for you. Like this would be the section that I'd actually take some questions.
Yeah, so that would come from me at the moment.
That's fine.
We've got the pre-recorded. So I've got a couple of things here and I really appreciate your efforts in delivering this. So going to the older adults first. So you talked about the martial arts, which is quite intriguing, and that sort of impact training, is it, because I understand that impact training is quite been significantly researched as well. Not so much for sarcopenia kind of based health, but skeletal health. So have you got anything to add around that with regards to impact training and increasing the skeletal density and those properties, if you don't mind expanding?
Yeah, you're fine. So what we did with this paper is we actually borrowed off the senior fitness test, like where we looked at the different parameters that were tested. So if you look at Delvecchio et al., like up the top there, and this paper is been accepted for publication. On the side here, you've got your 2-second step test, your arm curls, so that's your bicep curls. You're looking at your chair stands and your sit and reach and your timed up and goes. Like what Luke and colleagues looked at is in the older adults is if martial arts would help them improve in their different parameters. The one, I guess, cautionary thing when it comes to any like hard martial arts is the actual contact. Like as some older adults like are more prone to frailty and bone breakage, like this training modality has the potential to help improve like their strength, their bone mineral density, like the amount of muscle fibers. As for how much it's actually looked in, it's early days compared to like your resistance training.
Yeah.
So the wealth of data that's actually out there is not as great as the heavily researched gym-based activities.
Yeah, brilliant.
Does that actually explain your question, Tarek? Or
Sure, yeah, because I think a lot of people may ask about that because boxing tends to be a big thing, and you're holding pads and that impact training. But most certainly, from my understanding, and you're more researched in this area than I am, it's definitely leaning. It always leans towards muscle growth or the impact of lack of strength training, right? Whereas it's less so with regards to impact training. So, and that could even be right, you know, skipping or jumping or anything where there's sort of impact on the whole of the skeletal system compared to, you know, impacting with a kick or a punch or those type of things. Now, the other curiosity I have is, you know, in Australia, do we regard seniors firstly seniors. Can you lump seniors and older together, and therefore is it 55 plus onwards? Again, I'm really delicate here because it's it's relative, right? But in the guidelines, would we regard older adults as 55 plus? It's just something to clarify, at least in Australia.
Yeah, you're right. The general consensus is like, I guess, seniors, elderly, older adults. The PC term or the term that they head down in research is they're changing those terms more towards older adults. Like so that's the first part of the question. The second part, generally it's 65 and up. What we looked at in our demographic is 60 and up. Like because a lot of the research that's actually out there, it does look from 60 and onwards. But the general consensus when it comes to older adults is 65 and above.
Yeah, gotcha. Okay, brilliant. Now that covers my questions around there's many more that others may ask or be prompted,
of course, yeah,
with. But it's really fascinating. I think I'm really buoyed by the research that you and Luke, for example, are doing regarding impact training. and looking at the comparisons, because there's certainly not as much out there from your study. But from the kids' perspective, it's really good to see that they're taking more of obviously a serious, but more of a functional approach too. To make things fun. So what have you got to say around making these assessments, making fitness kind of fun and playful? Is there anything that you can kind of elucidate on that point?
Absolutely. So my general exercise physiology career, we're working more with older adults, but the comparison can be joined with younger children as well. A lot of our clientele, they've never stepped foot in a gym throughout their life. Like, having said that, we get them doing the same exercises like in a social gathering, and that tends to keep our clientele more so than the fact that they're working in a gym, so to speak. Like, it's that social gathering, it's that connection, and it's the friendliness that they really aspire for. As for children, and kind of to head back towards your question, I would really suggest that social impact. So if children do want to like participate in sport, it's a good way for them to make friends. It's good for their overall health, and it's much more functional. Like, it also adds in a little bit of safety from not focusing on training, maybe like you're only training your biceps and not your triceps, and you're actually conditioning your body into an issue. Like, you'll find instead of your body being in a normal anatomical space, all of a sudden your arm starts to head down this direction because your biceps are so strong, but your triceps aren't the antagonists or the contra muscle to keep everything balanced. You find that with a lot of guys that do their bench pressing. They focus mostly on their chest, but not a lot on their back, and they tend to have their hunched shoulders, which can actually impact them later on in life.
Yeah. I like that sort of lifestyle, being mindful of that, and especially for those trainers who may have more older adults or even just children that they're training. It's looking at this data and being kind of buoyed by it. It's very optimistic, and also the environment. You don't need to be, as you say, in a gym. You could do plenty of impact training or strength training, such as outdoors or in parks, for example. So
absolutely,
yeah, it's good to know that this type of research is not biased, it's not conventional, and I think it's moving beyond the conventional. And I think that's where maybe in the past it was quite sterile, and you looked at the evolution and the adoption of the functional movement screen and the adoption of functional training and functional fitness in general, as opposed to simply keeping the traditional kind of component. So any thoughts on that? Any kind of suggestions for those who are maybe potentially stuck in a paradigm, or and how does the functional side, it's a bit loaded this, but I suppose in
you're
a sense, how does the functional side kind of play out in terms of the research?
I guess how we kind of look at it, like, or me from a personal perspective, is like, yes, we want people to do resistance training. We want them to work on their muscles. Like, it's going to improve or reduce their sarcopenia. It's going to strengthen their bone mineral density, especially from the upper body. We want them to do aerobic fitness, like it's going to be good for their heart. The research is out there, like, but I think it needs to come back to, why are we actually doing any of the exercises for this client, and what benefit is it going to do for them? Like, instead of like, oh, they're going to be stronger, you need to think about them maintaining their independence. So them doing a sit to stand sounds like a fairly mundane activity, but if we can strengthen their legs and we can make sure that their movements are apt, it could be the difference of them getting up and off the toilet. And just little things like that. Like, you really need to think of why you're doing the exercises for this client and how it's going to benefit them in their activities of daily living and their quality of life. If they can't get off the toilet anymore, like, that severely impacts their self-esteem. It impacts their ability. Like, and and even their social interactions, like they're not likely to go out and live their lives that they should be able to live.
So kind of it's the way that the coach, the trainer communicates that to their clients as like you're almost selling, the outcome to say, well,
Absolutely.
you're not just lifting a heavy weight, or you're not just doing a get
Yeah.
up, as you say, you're doing that because it's going to improve your quality of life, or more specifically, we're going to help you so that you get out of bed, pain free, you get into bed pain free, and you get off the toilet, for example, and you're able to walk up and down the stairs. And then selling it in a way that, would you like that pain to kind of go away? Would you like to be stronger to be able to do these things? I think it's a very important point there. I love that, the way that the communication plays out, connected to the science of it all, and I think when you bring those two to the fore, it makes it enjoyable, I think, for both the coach and the client.
Oh, I think so too. I get a lot of satisfaction when we talk to our clientele. They're usually laughing, they're having a good time. At the end of their session, they actually say, I feel like I'm improving. Like I'm able to do this and I wasn't able to when I came here. Like that's massive satisfaction, not only for yourself, but knowing that they're doing better.
Yeah, and they've been able to embody and experience that. Yeah, it's really, it's powerful when this stuff is actually played out, right, in the real field, and it's good to see that this data is very pragmatic, and it's showing that we sort of ought not to be one-dimensional. It's good to look at how our clients will interact in different environments. Maybe, as you said earlier, a gym isn't suitable, so how about we change up our environment and manufacture a new approach for them. So it's important, I think, for trainers, coaches to be mindful of that, not to be one-dimensional, and to really understand how the client will tick, what's the suitable environment, and kind of personalizing the approach. I'm liking this conversation. I think we can certainly, you and I, jam again on this concept of personalizing this approach for older adults and kids. And a good friend of mine, Dwight, talks a lot about like fun and fitness, fun and play he's over in the Gold Coast, the Sunny Coast, sorry. And so his whole philosophy is in a sense, it's not only for kids, but you can actually take fun and play for adults, and all of a sudden, as you said before, they're smiling, they're laughing, whilst getting the benefits. It's
absolutely, it's a dynamic process. Like they're improving, they're feeling better, they're happy. Like you're happy, you're getting improvements, and you're seeing it like first and foremost. And I guess if you look at it from a business perspective, because let's face it, you're in this field, and you got a family to feed. They talk to their friends, and their friends say, "Hey, I've got something that I wouldn't mind improving," and they're likely to give you the positive feedback and say, "Oh, well, this person might be able to help you out." Like so, you're your own walking, talking advertisement, really.
Yeah, very true. Yeah. You become your genuine marketing tool.
Yeah.
To have those as a retention, but also as a way to attract new clientele. Now, I love it. This conversation's morphed into something beyond just data and stats, and I think I like when data and science really comes to life in this context, and that people can appreciate that both coexist.
Absolutely.
To improve our understanding and to be able to help as many people as we can in the most enlightened way possible. So it's been terrific, mate. Any final thoughts, or sort of for those who are going to be watching and listening in?
Well, I guess if anyone has any questions, like please by all means, contact us. You can contact me through Tarek. I'm happy to leave my email with you, Tarek. Like if anyone wants to get in contact with me. What my studies are, we're focused in Gold Coast. I would strongly recommend anyone that does want to get a skin check to please contact me. And not only are you looking after your health, but you're helping make a bigger picture of the study as it develops and progresses. Ultimately, it's a good thing for the research and the literature, and first and foremost, you're getting a a skin check, and skin cancer is very much a silent killer, and a progressive killer, like hypertension is.
Yeah, very good point. It's really, really good for those listening out there who feel that maybe there's been a sense of imbalance and potentially they've known that they've had exposure to too much sun. Take up that offer and all the best, Ian, with that research and that PhD pursuit, which has bigger implications, obviously, more than just certainly there's a personal endeavor, but it sounds like there's going to be some great ripple effects from that. So again, thank you, Ian, for all your help. And this will be posted back to the tribe, and we look forward to hopefully having you back sometime soon down the track.
And you're very, very welcome, Tarek. Thank you so much for extending the offer to present with you guys. And I hope I hope it touches somebody and it can help them out.
Definitely passionately delivered, and we really appreciate that.